Door to balloon time is the time interval from the moment that the patient arrives to the emergency room to the moment that the patient's heart vessel that was completely blocked is treated. It is very important that this time interval be as short as possible. We say that time means muscle. The more time is wasted, the more heart muscle is lost, and the worse the patient's outcome would be, including worsening of mortality. The patient would arrive at the emergency room door. The person's assigned at the front desk. As soon as the person signals any type of a pain that is like seems to be a classical heart attack, but anything that resembles a heart attack, they are immediately looked at, immediately addressed. Nobody in this category ever waits, and within 4 minutes on an average, an EKG is done and a diagnosis is made. The recommendations are that from the moment that the patient comes to the emergency room and says that he or she has a pain or a symptom like that, to the moment that the EKG should be done, is recommended to be less than 10 minutes. National averages are 7 to 8 minutes. Our averages again are 4 minutes. From the moment that the ER physician has diagnosed these patients, the cardiologist is called, the heart team is called in, the cath lab, the pharmacy, the phlebotomists. Everything happens extremely fast and expeditedly. Then the patient comes up to the cath lab. This is kind of the cardiologist's operating room. The patients are brought to this room, they are prepared for the procedure, and the cardiologist gets access to their hearts, finds out where the blockage is, and then opens up the blockage. Again, a heart attack is a heart vessel that is completely blocked, which needs to be opened right away. There is a variety of heart attacks that we're treating. There are lighter heart attacks and there are very serious heart attacks, the ones that need to be addressed right away. Thus, the guidelines in time have made statements that from the moment that the patient arrives into the emergency room to the moment that the heart vessel that has been completely blocked is opened, that this time interval be less than 90 minutes. Our hospital was able to perform really great advancement in this field through our new protocol that has been implemented 3 years ago. And through this protocol, we have reduced our times from about 77 minutes on an average 3-4 years ago to a time interval of 45 minutes as per the latest national database assessments. Wyoming Medical Center does participate in the very important national database organized by the American College of Cardiology. Hospitals that strive for excellence enroll data into this database, and we have the chance of comparing ourselves to the standards throughout the nations, and we have the chance of understanding what we're doing good and what we should do better. Anything that's shorter than 48 minutes shows that you're within the 10% best in the nation. So Casper has excellent treatment and very efficient treatment for these very bad heart attacks. We're really proud to come and say that we've seen mortality reduction anywhere from 25 to 50% lower than the national average. We have made even more advancements over the last 1.5 to 2 years in this direction, as we have introduced the concept of pre-hospital EKG. Thus, a patient who would call 911 and say that he or she has a chest pain, the ambulance would arrive at their home, and as soon as they arrive, they assess the patient in no time, and they perform an EKG in the field at the patient's home. This is extremely important because this way, the diagnosis of a heart attack, yes or no, is made right at the patient's home or in the field, wherever the patient is found. The EKG is then transmitted to the ER physician. The ER physician is called, he analyzes this EKG right away in the emergency room, and he activates pre-hospital STEMI protocol, as we call it. Everybody is paged, and not only that, but the cardiologist gets to see that particular EKG simply on his cell phone. It is important for our population to know that calling an ambulance is important to show the difference of what happens when a patient calls the ambulance at home for 911 as opposed to coming at the emergency room door. The time to address these patients and treat these patients is shortened by 10 to 15 minutes just by activating the ambulance system. Our first medical contact to balloon time is 55 minutes, again, as opposed to 75 minutes, which is the national average. So we are again at the forefront of this, and we need to not only praise what is going on in Casper, because within Casper, such times are close to 35 minutes or even less. So it's extremely fast. I'm also praising our colleagues out of outreach facilities that see these patients, work them out extremely fast, and they get to be transported over with a long driving time and long transport time to our facility, and our numbers are as such. It is something to be really proud of.